It's Rich. Happy to be here with you today. Today, what we're going to talk about is we're going to talk about the road to freedom in healthcare. So, for those of you that don't know me, my name is Rich Westermeyer. I'm the principal at Benesmart. We're a full service benefit consultancy. We operate in the Dallas, Texas, and St. Louis, Missouri markets. So, we're coming today to share some information on healthcare and really what's going on in healthcare and what's causing some of the headaches that employers are seeing on their healthcare renewals every year. So hopefully what I'm going to share with you is going to kind of enlighten you guys, show you what's wrong with our healthcare system, and then we're going to talk about a few ways that we can start to fix the things going on inside of our healthcare system. So without further ado, I'm going to share the presentation and I'm going to go ahead and get started. All right, so this is a journey, and it's a journey because it takes time to understand where we are now and what got us into the situation, and it takes time to understand where can we go and what can we do to fix the situation. So for today, what we're going to do is we're just simply going to set a baseline, and this baseline is going to give us the information that we need to be making better decisions in healthcare. So we're going to look at this as what it truly is. Are we in the business of healthcare? So, as an employer, to answer this question, you need to first ask yourself three questions. Does your company offer health insurance to your employees? Are you responsible for making decisions related to the coverage, whether it relates to the plan design, spend, and cost? So, these are the first two questions you need to ask yourself. And then the third question you need to ask yourself is healthcare a big line item on my expense report? If you answered yes to the first two and you aren't quite sure on the third one, or if you answered yes to all three, well, I got news for you. Regardless, you are in the healthcare business, whether you want to be or not. So let's look at where do Americans get their health insurance? So this will give us a little bit of insight into what's going on in the marketplace. So 51% of Americans are getting their health insurance through their employer. Now take a look at this. This is interesting. We got 17% getting their health care through Medicare, another 17% through Medicaid, and then 5% on the individual market. So that's 34% plus throw on that 5%. That means about 39% of individuals are getting their health care from the federal government, because if you're in the individual market, you're getting it through healthcare.gov. So the majority of Americans are getting their health insurance through employers. There are 31.7 million small businesses in the US. 19% of those, or 6 million businesses, have paid employees. This accounts for 61 million workers in the US. So who pays for it if it's coming from the employer? Well, do the employees pay for it? They pay for a portion of it in some instances. Most employees pay for just a small portion of their health insurance. What about the employers? A survey from the Kaiser Family Foundation found that the average percent of health insurance paid by employers is 83%. So on average, employers are paying 83% of employee-only coverage for individuals and 73% for family coverage. Is Santa Claus paying for it? If you see him, tell him I still want that Albert Pujols rookie card. So no, Santa Claus isn't paying for it. That means that you, the employer, are paying for it. So you are in the healthcare business. Let's talk about where does labor cost rank for you. Typically, in the majority of businesses, the cost of labor, which is made up of both direct and indirect costs, is a top 3 business expense. So think about where labor ranks in your business and how important the cost of labor is to the profitability of your organization. Benefits go into that as a direct cost of labor. So here's some startling news. An article recently published by Healthcare Finance said that U.S. employer healthcare costs are projected to increase 6.5% in 2023. This projection is more than double the 3% increase that the healthcare budgets experienced from 21 to 22. Are you okay with the cost of doing business increasing 6.5% for the foreseeable future? Over the last decade, healthcare has increased on average about 4.2% as part of the employer spend. On average, that 4.2% has led to over 60% increases completely across the entirety of the last decade. So what's driving the cost of insurance? Well, it's healthcare spending. We take a look at this graph here going all the way back to 1988. We can see the total national health expenditures are on a roar, just a complete climb. And matter of fact, in 2020, private healthcare expenditures surpassed public healthcare expenditures. So you can see overall, we're north of $4 billion in total healthcare expenditures going into this decade. Health spending totaled let me back that up a second. So we're north of $4.2 trillion, trillion with a T and not billion, because we can go all the way back to 1970. In 1970, healthcare spending was just 74 billion. By 2000, that number was 1.4 trillion. And just 20 short years later, that was 4.2 trillion. So healthcare spending is not slowing down. So how does this affect your people? Well, right now, 1 out of 10 adults nationwide owe at least $250 worth of medical debt. So 10% of your employee population probably has some type of medical debt. Total medical debt among consumers as of June 2021, and we know this number is continuing to grow, was $88 billion. 26% of people with medical debt owe more than $5,000. So let's break that down for a second. If 1 out of 10 people in your workforce has medical debt, well, 26% of those with medical debt owe more than $5,000. This is from a study done in 2019. We can see the share of adults with medical debt by the amount that they owe, starting with a jump here at 1,000 to 2,000, 20%, 2,000 to 5,000, 22%. Look at this. This is a lot of medical debt that your employees are carrying. So what's driving all this? Why does the cost of care continue to rise? Well, to understand this, we need to first admit that healthcare is a broken system. Here's a great quote that I love by Walter Cronkite. America's healthcare system is neither healthy, caring, nor a system. So how do we fix it? Again, in order to fix it, we must first understand it. And in order to understand it, the key here is to follow the money. Now, when we talk about following the money, we're going to look at quite a few different things, but where's the money going? So let's talk about the Pareto principle. You guys have probably heard this before. The Pareto principle, otherwise known as the 80-20 rule, simply states the majority of results tend to come from a minority of causes, no matter what you're looking at. So just like 20% of your max effort produces 80% of your results, or 80% of your effort is only giving you a 20% result. So how does the 80-20 principle apply in healthcare? Well, it applies in multiple facets of healthcare. For starters, 20% of the carriers are making 80% of the money. We're going to talk about that. 80% of premiums are care and 20% are profits. That's the ACA 80-20 rule. We're going to dive into that as well. 80% of claims come from 20% of your people. I bet you didn't know that. But 80% of your claim spend is coming from just 20% of your people. Matter of fact, 5% of people make up 50% of the claim spend. 80% of PBMs, known as pharmacy benefit managers, where we get our pharmacy and our drugs from, 80% of the PBM market share is owned by the top 3 health insurance carriers. So let's talk about it. What's driving this? Well, number one, it's limited options in the marketplace, right? When we talk about limited options, we're talking about the large major carriers. You have Blue Cross, United, Cigna, Aetna, Humana. These are the major carriers in the market. And let's take a look at their stock price over the last decade. So you want to know why your health insurance premiums increase every year? Well, take a look at this chart here. Going back to 2010, the year that the Affordable Care Act was implemented, UHC had a stock price of 36, Anthem 56, Cigna 36. 12 years later, look at these stock prices. $516 for United Healthcare, $472 for Anthem, and $286 for Cigna. Simply put, the more an insurance carrier spends on care, the higher they can charge for premiums. So what would incentivize these carriers to better manage care? health companies spent nearly $690 million on lobbying federally, which was 175 million more than the second place category. Within the industry, the largest lobbying bills were racked up mainly by pharmaceutical companies, which spend 356 million on federal lobbying alone. Maybe it's not always about trying to fix something broken. Maybe it's about starting over and creating something better. And I think if we start to understand the problems that are going on inside of health insurance, we can really understand how to best fix it going forward. So how did the Affordable Care Act affect premiums? Well, number one, there was a pre-existing condition clause, right? And this is a good thing, I think, but as a result of the Affordable Care Act, these large carriers were no longer able to deny somebody coverage for a pre-existing condition. That means anybody, no matter what stage of illness they have, no matter what kind of health care that they need, they cannot be denied coverage. Okay, so this is a good thing, in my opinion, but this is also one of the major factors that are just driving costs. Because in order to account for pre-existing conditions and paying out ongoing claims, these carriers price that in to their Affordable Care Act plans, the fully insured plans. And this leads us to this community rating. Community rating means that they're rating your group based on things like age, geographic location, sex, and these community ratings are blanket across the board. So you don't really have a choice. You can't have preferential treatment because you have a healthy group. And then finally, there's the 80-20 rule. When we talk about the 80-20 rule, we're talking about the medical loss ratio. So the medical loss ratio for small group and individual health plans is 80-20, meaning that 80% of the premium dollars have to be spent on medical services and quality improvements, leaving the remaining 20% for administrative profits. So that 20% remaining is where the carriers are making their money. So let's go back to the premium example here. And let's say we have $1,000 premium and the carrier's administrative cost can only be 20% of that premium. That's limited to $200. So with that $200, obviously there's administrative costs and the profits that they have to get out of that. Well, next year, if they raise that cost to $1,100, they're going to get 20% of that $1,100. So what incentive does a carrier have to better manage care for the people under its plan? It doesn't. So this is one of the main things that continues to drive cost year in and year out. Here's another 80-20 rule that I want to talk about. 80% of healthcare expenditures come from just 20% of your people. So let's take a look at this chart here. Contributions to total health expenditures by individuals. Now, this is going back to 2019, but this still stands today. The top 1% of people with the highest health spending account for 21% of total health expenditures. Again, the top 5% account for 50% or 49% of total health expenditures. And we get to that top 20. All right, so if you've got a group with 100 people in it, 20 of them are accounting for 81% of health expenditures. What would change if you were to strategically manage the care for the 20%, right? This is where we need to start to think about. So the question then becomes, how can we provide better care to the 20%? And how can we leverage the healthy 80% to take more financial responsibility within our plan? Here's another example of the 80-20 rule. PBM market share by total equivalent prescription claims. And this is in 2021, but we can see that 80% of PBM market share is owned by Aetna, Cigna, and UHC. Just looking at these top three here. But we can see not only is it a problem that they own the large majority of the prescription claims managed, but the problem that you also have is the relationship between the carrier and the PBM. Because not only is the carrier profiting on your premiums, but here we have examples of the carriers like Aetna, Cigna, United, who own these large PBMs. They're also profiting on these pharmacy claims, okay? And the nature of the relationship is that UHC charges Optum. Optum charges UHC, and the money just passes between each company. So to understand how to fix this, we have to first start and figure out where is the money going. So let's talk about how do PBMs get paid. So the three main ways that pharmacy benefit managers are making money are on rebates, spread, and fill. So let's talk about rebates first. Rebate sharing. Insurance companies pay the PBM to manage the drug costs, and they get rebates from the manufacturers. So the PBM often retains a portion of the rebate. So the manufacturer is providing the PBM with a rebate, and that rebate is for them putting their drug in the formulary, right? So now the PBM, just for having that drug in a certain tiered formulary, is getting a rebate when they put that drug in that tiered formulary and then they fill it. The PBM also negotiates prices with the manufacturers. So then we go on to pharmacy spread. Spread involves billing health plans for amounts higher than they reimburse the pharmacies. So if the PBM is reimbursing the pharmacy $8 per prescription, they may charge the health plan $12, and that $4 is spread that they're making on the prescription. So not only are they getting rebates from the manufacturer, but they're getting spread from their own company, right? So UHC is charged $12, the PBM's paying $8, the PBM's getting rebates from the manufacturer, so they're more likely paying $3, right? Charging $8 or paying $8, I'm sorry, and then having that rebate sent back to them, and at the same time making money on the spread. And then finally, the fill fee. So if we back up to this slide a second, how many people get their prescriptions filled at CVS? Well, every time somebody gets a prescription filled at CVS, Aetna's getting a fill fee, right? Because they own CVS or vice versa. So in addition to that, there's administrative fees, there's direct and indirect remuneration going on inside of these plans. So these direct and indirect remunerations are fees on pharmacies imposed after a patient sale. All right, so there's a ton of fees going on. And if that doesn't get your mind thinking, okay, who's making money? Let's take a look at this chart, because this really does a great job of illustrating where all the money's going. And when I look at this chart, man, it's just kind of mind blowing. But let's start up here in the top left corner with the health plan. Okay, so with the health plan, we have the patient paying a premium to the health plan. All right, so the patient's paying the health plan for the benefit of having health coverage with a pharmacy benefit manager in there. And then the patient's also paying out-of-pocket costs for drugs, right? These are prescription copays, right? And then once the patient pays the pharmacy, the money then goes over to the wholesaler, because the wholesaler's got to get paid because the wholesaler's sending the drugs to the pharmacy, right? And then the wholesaler is buying the drugs from the drug manufacturer, okay? Now the drug manufacturer is sending rebates to the pharmacy manager, right? And then the pharmacy benefit manager is sending rebates to the health plan. But do those rebates come back to the patient? Not on fully insured plans. And that's part of the problem, right? So we have this relationship of so many people getting paid in this series. And one of the main ways that we can cut on costs in a medical plan is by putting a better pharmacy benefit manager in place. Typically, an average company will have about 20% of their expenditure going towards RX. So if we can focus on the big RX items that are costing us a lot of money, that's one way that we can better manage our care. So what if there was a better way to do it, right? There is a better way to do it. And that better way to do it on the pharmacy manager side is with a fully transparent pass-through pharmacy benefit manager. These exist and they're out there, and they will pass through rebates and they will eliminate spread throughout the process. So this is one way that we can start to fix our health plans. So in addition to that, I think there's three main areas of focus that you need to work on in order to have the best possible solution here. And that's number one, we need to make data-driven decisions. So there's a lot of data inside of a health plan. And sometimes when we dive into the data, we can start to see and follow where the money's going. And this is truly how you can get an idea of how to create a better way to do it. In addition to that, you need to decide on your funding. So alternative funding methods are are one of the main ways that employers are able to play differently. And I encourage you to really think about this, because you either have to pay what the carriers are willing to charge you, or you have to play differently. So it's either a pay or play differently type relationship here. And alternative funding is one of the main ways that today's employers are playing differently by coming up with creative solutions that aren't governed under the Affordable Care Act. And then finally, third, and one of the most important things is utilizing cost and cause containment solutions. So it's great to have the data and it's great to understand where the money's being spent, but now we have to start to take action behind that. And when you have the data and you get the recommendations to start to take action behind this, you can start to contain some of the costs inside of your plan. But it goes further than that. This is about not only providing better coverage at a lower price, this is also about having a healthier and happier workforce. And in order to have a healthier workforce, we have to look at cause containment solutions. So what's going on inside of that health plan will tell us a lot about the health of the population. And when we start to better manage the care that your people receive, you're going to have a better managed plan. So this is some of the things that's going on in health insurance today. Hopefully you can take this information and start to better understand why your premiums are continuing to rise and what you can do about it. I will tell you that there's another presentation in this series. We'll be having that presentation out for you guys soon. But take this information, sit with it, and start to understand it. Go back and review this presentation. The question that I have for you guys is, if 64% of employers are already self-insured, what are you waiting for? If you want to start to see what your options look like, contact us today. Thanks, and have a great day.